Okay, great. Thank you, Dr.
Okay. All right. Thanks, Sarah. Hi, everybody. Thanks for joining from wherever you are. I'm here to talk about, as Sarah mentioned, some important concepts when it comes to different problems that can affect the foot and ankle, and how we can treat them, and how these may sort of impact your lives. And again, if you have questions, feel free to ask, and then at the end I'll leave some time for some questions and answers. But as Sarah mentioned, my name is Adam Isaac. I'm a podiatrist with Foot and Ankle Specialists of the Mid-Atlantic. We're a large podiatry practice in the area with offices all over Montgomery and Frederick County and a lot of different states too. And if you should have needs, you can always, at the end, I'll give our practice information, and you can certainly go on our website and find a location that works for you. I wanted to just start by briefly talking about, obviously I'm a podiatrist by training with more of a surgical background and a specialization in amputation prevention of people with diabetes and limb preservation. But, what do podiatrists do, and what kind of disorders can affect the foot and the ankle? There can be disorders of skin and nails, bones, joints, and tendons, nerves. Podiatrists deal with fractures and different kinds of trauma, as well as sports medicine and sports-related injuries. Podiatrists perform elective and reconstructive types of surgery. There's an interest in biomechanics and affecting how the feet encounter the ground as we walk and run and do all those other kinds of activities that we like doing. As I mentioned, diabetic foot care and amputation prevention is a big part of what we do, and in particular what I do, what I focus on, and that we really treat everybody, kids, adults, seniors. We really treat all age groups. I want to start by talking about some common foot problems. This figure sort of illustrates that very well, because there are multiple different problems on this one foot. And I'll go in a little bit more detail during the presentation about each of these. But first and foremost, people often hear about bunions, this kind of large bump on the outside of the foot near the big toe, or hammertoes, where the smaller toes become contracted or clawed, where you have sort of prominent areas on the tops of the toes and the tips of the toes that may be rubbing against shoes and other things. Fungal toenails are a big part of what we treat, where there can be discoloration or thickness of toenails, or toenails causing pain. And diabetes is a big part of what podiatrists treat as far as the foot and the ankle. So what is a bunion? A bunion is a big bony bump on the outside of the great toe joint. So it's caused when the big toe deviates at the joint with the metatarsal and starts to go inward towards the other toes. And when it does that, it exposes the medial eminence, or that prominent bone on the outside of the foot that you can see as demonstrated on this X-ray. So the big toe goes one way, the metatarsal goes the other way. And instead of having a nice straight line, essentially, for the joint where you see those other toes and metatarsals, you have almost a V or a U shape, and this joint becomes non-congruent and deviated. So this bump forms and can become problematic in that it can start to rub against shoes. It can cause pain during walking and standing. Keep in mind that we push off of our big toe joint. There's two little pea-sized bones underneath that first metatarsal head called sesamoids, you may notice in the X-ray, that are really important as far as push off. And so when our toe starts to drift one way, the big toe starts to drift one way, and the metatarsal starts to drift the other way, the joint no longer functions in a normal way, and this can cause issues when it comes to doing activities. So this bump can form. We can also have changes at the joint level, where there's degeneration of the joint, arthritic changes, and this can cause significant pain. There are many different treatment options when it comes to treating bunions. And this will be a recurrent pattern during the presentation, at least from my standpoint, but treatment depends on the patient. So every patient requires a different treatment based on what their needs are, what their activity levels are, and so on. So treatment really varies based on who you are. It can depend on also things like medical history, where you might need surgery, or it might be recommended that you need surgery, but there might be other reasons why you shouldn't have surgery, like other medical comorbidities. So those are things that are important to consider. There are options as far as treating bunions without surgery. So things like wearing wider shoes, for example, shoes that provide more support in that area, that are wider around the toes, around the toe box, that won't rub against that bump of bone during walking and standing. And a lot of the different shoe companies have a variety of widths as well as shoes sizes. And I'll talk more about this, but wearing wider shoes can certainly be a non-surgical way of treating bunions, as well as adding padding or even trying to protect that bump with additional cushioning or padding. When it comes to surgery, there are, of course, a lot of different options based on not just the patient, but based on the severity of the bunion. In this particular picture, you can see that there was what was called a fusion of the joint at the base of the metatarsal, where 2 screws were placed and the bone was repositioned. So there's no longer that drifting of the toe. The toe is nice and straight and that bump is no longer present. Now, surgery is a great option for correcting bunions, but again, not the only option, and certainly has to vary based on who is the patient. Things like shoes I mentioned, and orthotics, which would be more insoles or custom arch supports that would go inside of a shoe to support the area and give a little bit more cushioning to decrease pain. These are some examples of orthotics. Orthotics are essentially a custom version of the arch support that you would go out and find in the drugstore. While there's some benefit to just for some minor problems going out and getting arch supports that are sold in a store, they're obviously not tailor-made, whereas we can take foam impressions or plaster casts, or actually what we do now is 3D scanning on an iPad and send that off to the lab that we use, and kind of incorporate all the different contours and shapes of the foot, and essentially develop a custom molded insert that will slip into the shoe and accommodate the foot or correct certain deformities. So orthotics are certainly one treatment option for bunions, and they come in different lengths and with different materials and thicknesses, and again, very much patient dependent, but those are some examples of what custom orthotics look like. Another common problem of the foot are hammertoes. You may hear different ways of describing hammertoes. For example, claw toes would be another way of describing a hammertoe, but essentially a hammertoe is a buckling of the toe. So whereas a normal toe is nice and straight through each of the joints in the toe, there's 3 bones that make up the toe, except for the big toe, which has 2 bones. 3 bones of the toe have contracture at the joint, and you see this buckling, this kind of curling of the toes. There can be different causes like abnormal biomechanics or trauma to the area, or some people are just born that way, or have the family history, the genetics to develop such a condition. But hammertoes are definitely a very common problem that we see. And not only do the hammertoes themselves cause issues because of the contracture of the toe that they cause, but there are also other issues that arise, such as painful calluses, corns, essentially buildups of dry, dead skin on these prominent parts of the toes. For example, at the tips of the toes, where the toe is rubbing against the ground abnormally, or in the middle of the toe, where the toe is sticking straight up and could potentially rub against the top of a shoe. These are issues that are secondary to the underlying pathology of why the hammertoe is there, why it has developed, but these are certainly things that bring people into the office and that we can treat. Also, if you look at the top picture and how essentially the middle portion of the toe is pointing straight up, not only does this affect the toe, but actually this causes a phenomenon known as a retrograde pain, where pain is actually transferred back into the foot based on how the toe is pushing up against the ground. Remember, the ground isn't going anywhere, so it's the toe that has to accommodate. And by pushing up against the ground, it can create some back pressure or retrograde pressure that can cause a lot of pain. Similar to bunions, hammertoes can be treated both surgically and non-surgically, and that in large part depends on who the patient is and what the patient needs are specific to the individual. So there's certainly ways to correct these things with surgery. And the picture here shows a toe that's been straightened and fused and held in place with a long intramedullary screw. But this, again, may not be right for everybody. And so there's different ways to maybe pad these prominent areas of bone on the toes, to find shoes that are soft, that have a mesh, kind of like a running shoe that won't cause a lot of friction or shear force against the toe, to find toes with that are wide, that give enough room. And then there's padding options. Essentially, you can find things that are like wearing a sleeve on your toe. So these kind of silicone lined or foam lined products that kind of roll over the toe and serve to protect and serve as a barrier, in between the toe and the shoe. Another common condition we see are fungal toenails, or fungus infection of the toenail. Now, when I say infection, it certainly is an infection, but it's not the type of infection, of course, that's going to make anybody, very, very sick or require some sort of visit to the emergency room or the hospital, but it is an infection nonetheless. And it is an infection that can not only spread from toenail to toenail, it can spread from toenail to fingernail and to other people's toenails and fingernails. So it is contagious in that respect. And so it's important, I think, if it becomes severe, that it does need to be treated. But it is an infection of the toenail with a dermatophyte, which is a type of fungus. It leads to a thickening or discoloration of the nail. In many cases, these nails become brittle. They become detached or separated from the underlying nail bed. They can become caught on shoes or socks. They can lead to painful ingrown nails where the nail is so thick that it's digging into the skin. So there's a lot of different ways that, even though fungus in and of itself is not a quote unquote serious medical condition, there are a lot of problems that fungal toenails can lead to that require treatment. First and foremost, we want to keep the toenails from becoming too long or thick. As far as treatment options, there are different medications that can be used with different effectiveness rates. For example, there are topical antifungal treatments that you would apply to the affected toenail, usually once a day for a minimum of 3 months, up to a year in some cases. That would be a very, very slow, gradual process, very tedious, obviously trying to remember to apply something to your nail every day, and probably ranges somewhere in the 30 to 40% effectiveness range as far as curing the nail fungus. So you go through all that and there's less than a 50% chance that you're going to resolve the problem. However, with that said, it's generally safe, easy to use, doesn't interact with any medications. There's very little issue with the medication entering into through the skin and interacting with other organ systems and medications. So usually it's safe, but the effectiveness is somewhat limited. There are prescription types of topical antifungal medications, as well as over-the-counter. Most are over-the-counter and frankly probably work just as well. The most effective treatment option for fungal nails would be a systemic medication, an oral medication called Lamisil, which comes in a tablet form. It's very, very common now and generic and inexpensive. It's a pill that you would take once a day for 3 months. You would essentially then wait for the nail to hopefully grow out into a healthy or an improved appearing nail. The medication probably has somewhere in the range of about 60 to 70% effective. So again, just goes to show you that probably the best treatment option for this still lingers around the 60 to 70% effectiveness range. It does come with some potential a warning about impacting liver function. It's a very, very small chance, but it is something that needs to be addressed with some baseline blood work just to make sure that if you're going to go on this medication, that the liver function is normal and that taking the medication is safe. If the liver function is not normal, then it's probably best that you avoid this medication or potentially discuss, potential causes of why the liver enzymes might be elevated. There's other treatment options too, besides topical and oral medications that you may hear about, including laser therapy. This is something that's not universally done. You may, but you may seek this treatment if you've tried other things that haven't worked. The laser essentially burns the fungal nail off. It requires multiple treatments. It's usually, as far as I know, not not covered by insurance. So it's something that you're going to have to pay for out of pocket. But there are a lot of offices around the area that do it. And for people that have tried other treatments like topical and systemic therapy, then it's certainly an option. The last option, which is usually the least preferred option, is to remove the nail surgically, done as an in-office procedure. You might say, why would I want to do that? I can live with it, but there are some people who it really affects. It bothers them cosmetically as far as how the nail looks. It may bother them functionally as far as the nail getting caught on things or rubbing up against shoes and causing pain. So we can certainly remove nails. We can remove one, we can remove multiple, we can remove all, although I wouldn't recommend doing them all at one shot. I guess that depends on your personal preference and threshold for pain afterward. But removing the nail is certainly an option, and we can see how the nail grows out going forward. I wanted to touch on diabetes, even though this isn't specifically a webinar about diabetes, but diabetes is a really important part about what we do as podiatrists. It's really an important part of what I do, having done training and doing research now on diabetic foot ulcer healing and amputation prevention. But I just want to give you some awareness of what diabetes is and how it can affect the feet. And that you should know diabetes is a chronic disease in which there are elevated levels of blood glucose that are too high that can not only impact the feet, but also the cardiovascular system, the eyes, the kidneys, the nerves. And in the feet in particular, what it can do is it can lead to the breakdown of skin. It can lead to skin ulcers that can become infected, that can go deep into deeper layers of tissue and can lead to lots of problems like needing to go to the hospital or needing really, really strong intravenous antibiotics, or in some cases actually requiring amputations as part of the feet. So diabetes is a really big problem worldwide and in this country. There's just hundreds of millions of people worldwide with diabetes, and it keeps essentially going up, unfortunately, even though we have lots of educational programs in place. And that, worldwide, about 20% of people older than 65 have diabetes. So just think about that. In the US, for your information, it's closer to about 10% of the population. About 30 million people have diabetes, and that's probably a year or two old data from the CDC. This picture kind of demonstrates what I was talking about. You have the skin, if you can imagine the socks, the black socks representing your skin. Over time, because of a decreased sensation from nerve damage from the diabetes, because of changes in the foot shape and architecture, as well as a decreased skin integrity and impaired circulation, you have these patches of skin, particularly on the bottom of the forefoot, the ball of the foot, that wear away and break down the skin and form these open wounds that can become susceptible to other complications. So specifically to diabetes, but you can use this generally too, in order to avoid complications. It's important to check our feet every day to make sure there's no open lesions or draining blisters or any redness or any abrasions that shouldn't be there, that aren't easily explained, that necessitates further inquiry, further treatment in some cases, and there should be an explanation for why there's something going on in your feet. Also, to wear supportive and well-fitting shoes as much as possible, and to avoid exposure to extreme temperatures like cold, or even as we get to the summer, you don't think about it often, but think about that sand on the beach as you're walking barefoot, and it's the middle of the day and it's hot. And for people with full sensation, that may not be a big deal, but if you have diabetes or a loved one has diabetes and they have decreased sensation from nerve damage, they may not perceive how hot that actually is, and they may burn their skin. I've seen it. So need to be very, very careful about that. To seek immediate care for anything that's concerning, an injury, a cut, red, hot, swollen areas. These are things that shouldn't be left alone. It really necessitates treatment soon, especially if someone has diabetes or other risk factors too. I should mention that people can have other risk factors like poor circulation or autoimmune disorders that can affect their skin and lead to these complications. And to just have an annual foot exam, it's recommended that everybody with diabetes have their feet checked at least once a year. If they have other risk factors, it should be more often than that. I mentioned supportive shoes, and this is just a graphic that I think illustrates well what a well-fitting and supportive shoe should incorporate. It should have a soft upper area where your toes rub against. It should have some foam padding or some sort of padded tongue of the shoe that will provide cushioning to the upper part of the foot. Especially in some cases, people have bone spurs on the top of their foot, and this is an area in which some additional padding can provide a lot of relief. We want to look for a lot of cushioning through the insole, a lot of support on the outside of the shoe. There's a few tests you can do when looking at a shoe. You should not be able to just bend it back and forth. You shouldn't be able to bend it like a flip-flop. You shouldn't be able to twist it. And if you take the heel, you shouldn't be able to squeeze the heel. If you can imagine doing that with your shoe. This is an example that works better in person, but obviously we're still doing a lot of Zoom meetings even now. So you shouldn't be able to bend your shoe in half. You shouldn't be able to twist it and wring it out like a dish towel, and you shouldn't be able to squeeze the heel. Those are my tips for looking for a shoe that provides a lot of support. Some other tips now to keeping feet healthy. We want to wash and dry in between our toes. In between our toes can retain a lot of moisture, believe it or not, and fungus, not just the kind of fungus that I showed with the toenails, but fungus that affects the skin, better known as athlete's foot or tinea pedis, can impact in between the toes. If toes are not dried properly, then moisture builds up, and it's a perfect environment for fungus to come in and cause all sorts of havoc, like itching and skin peeling and scaling and other kinds of things that you want to try to avoid. Excuse me. You want to try and trim nails straight across. I know there's a big urge, and I am guilty too, as someone who has chronic ingrown toenails, to try and dig in and cut the corners out. But believe me, you will observe that if you try and dig the corner out, inevitably you'll end up cutting more than just the nail. You may leave some of the nail embedded in the tissue, and as the nail grows out, this can cause a lot of problems, like ingrown nails that become infected and need other kinds of procedures. So best advice, best practice is to let the nail grow out a little bit longer, cut it straight across, and avoid the urge to cut it at a real severe angle. You can also use a brush to remove debris that may form under nails. And also it's important to especially moisturize the skin daily. As we get into the warmer months, our feet sweat a lot, and sweat is, there's salt, sodium in the water, and what does that do? It can dry the skin. So even though we think of perspiration as keeping things moist, when that sweat, when the water evaporates, it's left, it can lead to a lot of dry skin. So even in the summer months, when it's warmer and we're not thinking about dry skin as much as the winter months, it's important to really moisturize the skin daily, find a good quality moisturizer and use it at least once a day on your feet. So more tips, and a lot of these may seem redundant, but I think it's worth noting that you want to make sure that you avoid letting small problems become worse. So you want to be proactive, and you want to avoid bad consequences from these things. So even if it seems minor, even if it seems not that big a deal, it's important to make sure that it gets attention. Pain in the foot is not normal, and so it's important that we address that. Check your feet every day for cuts, blisters, redness, swelling, nail problems, etc. Really check. If we have trouble looking at our feet, use a mirror. If you don't have a mirror, take your phone, put it on selfie mode, and look at your feet. Do a foot selfie. That's a good way to visualize what's going on the bottom of our feet if we're not able to, easily see these things. If you have diabetes, make sure your blood sugar is checked routinely to eat a healthy diet, exercise, do all the things that your doctor wants you to do. These are going to help not just your feet, but it's going to help your overall health too. Wear the right shoes and socks. Again, shoes that should fit well. They should be supportive. If you have issues like bunions, hammertoes, you're going to want to look for shoes that are wide around the toe box. And we want to find socks that are breathable. So we want to find socks that wick away moisture, that we can change daily. For people with diabetes, there's good advice that you want to avoid dark colored socks, because in case there is a problem that develops, like a blister or bleeding, we want to make sure we visualize that right away. And so wearing white socks would be the advice. Shake out your shoes before you wear them. So if you like to go on hikes in the area or on trails, you'll know that little pebbles, little pieces of twigs or whatever from the outdoor environment can get into your shoes. You may feel that right away. Someone with potentially at high risk for complications, or with neuropathy, nerve damage, they may not feel that. They may be walking on pebbles or rocks or a sharp piece of stick for minutes or hours, and this can lead to serious problems. So make sure you look inside your shoes before you put them on and try and shake them out. I mentioned moisturizing your feet. What I didn't mention is don't do it in between your toes for the same reason that, for the same reason that fungus can develop in between the toes. If you don't dry them really well, then you want to make sure that you avoid retaining moisture, and putting a moisturizer in between your toes is not the recommended strategy. So if you're going to moisturize your feet, do it everywhere but in between your toes, and again, to get periodic foot checks. Don't ignore any abnormality or pain. Do not perform bathroom surgery. That's my advice. Bathroom surgery is another way of saying, well, I have an ingrown toenail or a blister, and I'm going to go use that old sewing needle that I'm going to heat up, or just rub down with some hand sanitizer and try and address this myself. And then by the time you're done, you've got you're running frantically for rolls of toilet paper, or trying to stop bleeding, and looking for antibiotic ointment and band-aids, and running all over the place. So if there's a problem, try and let somebody who's trained deal with it, and try and avoid bathroom surgery. Another good point that's listed here is to avoid using medicated pads without your doctor's advice. So for example, people who suffer from corns or calluses or even plantar warts, you can easily go out and get some over-the-counter treatment options. These are typically benign, and they can be effective. However, keep in mind that the active ingredient in these pads is salicylic acid, which is, as the name implies, an acid, which can erode layers of skin. So if done overzealously or improperly, could potentially lead to a burn or other problems. So if you're going to use something like this and you have risk factors, definitely check with a doctor first. It's that time of year. We're all guilty of it, and some people prefer it, but my advice is to try and avoid walking barefoot. You just don't know what's around the environment. I have patients with diabetes who in their own home step on sewing needles, or around the yard or house, there's an old rusty nail from a project that wasn't cleaned up. I mean, these things, they happen, and they lead to all sorts of problems. So avoid walking without shoes. At least if you step on something, your shoe can create more of a barrier. Avoid tight shoes and avoid going out without socks. Avoid letting your socks bunch up, because this can create potentially blisters and other pressure spots. As far as people soaking their feet, I know this is something that people really, really like to do. I would, and that's totally fine. And you can add even something like Epsom salt, which can be soothing, but you want to try and avoid soaking your feet in water that's too hot. So you want to just make sure it's in the warm range of things. You can use your hand to reach in first and use that as a tester before you put your foot in. But you definitely want to try to avoid water that's too hot if you're going to do soaks to relieve achy muscles and joints and things like that. Avoid the hot sand, as I mentioned, especially this time of year at the beach. Want to make sure that you can try and get off that sand as quickly as possible and avoid problems. And not as much a problem this time of year, but exposure to cold, conversely, can create lots of problems, especially in the really, really cold months if our feet are exposed for too long. That is the majority of what I have to say. I know there's usually a lot of questions, and I'm happy to do that. I'll just give your attention to my email address down there at the bottom, aisaac@footandankle-usa.com. And then the website for our practice is that footandankle-usa.com. And on the website, you can find, like I said, information about our different offices. We have a ton of offices in Montgomery County and the surrounding areas. And you can always email me if you have any questions. I'd be happy to help. And that's my other job. Those two kids, they're 4.5 and 2.5 now. So that's where I do my real work when I'm done seeing patients. But I hope you found this helpful. And if you have any questions, feel free to ask now or send me an email. And thanks for having me back.
Thank you, Dr. Isaac, and adorable kids. Thanks for sharing. What a treat. Great presentation. And we already have a few questions, so I'll go ahead and get started. Let's see. First question is, do you recommend alpha lipoic acid for neuropathy? And do you have any suggestions to help neuropathy?
That's a good question. So neuropathy is complicated. Neuropathy can have a lot of different causes. Neuropathy can have a lot of different ways that it presents. So there can be painful type of neuropathy where people experience sharp shooting, stabbing like pain. It can be constant. It can come and go. It can be worse at night. There's a lot of different ways that neuropathy can present. Some people on the flip side develop numbness, which can, when you think about it, is I guess good because you're not in pain, but it's actually really dangerous because of all those things that I mentioned you're not feeling. So neuropathy can have different causes. It can present differently. There are different treatment options, some of which are more in the line of supplements and things like that. I think there are some pretty well proven medications that work for neuropathy. In particular, gabapentin is a very common medication for neuropathy, and others that are more recent, not so much anymore, but more recent than gabapentin are Lyrica. You may see commercials for that, or even off-label use of Cymbalta is used in cases in which there is neuropathy. So those are really the mainline treatments for peripheral neuropathy, so nerve type of pain. There's other, as I said, supplements. There's other formulations you can find. There's so much out there, and there's such a lack of good data. This is very common across the board, by the way, for the entire medical field. But so I don't know that one specifically, it's not something that I recommend to my patients unless they've tried it and they say it works, in which case I say go for it. But I don't know of any real evidence-based studies that support that, or at least in a large scale. But if it works for you, then you can try it. Another treatment for neuropathy that I didn't mention is capsaicin, which is a topical over-the-counter medication. It's derived from hot peppers. And this is actually a medication that has some evidence to it that over time, over 3 to 4 weeks, the cream can penetrate the dermis and impact, actually dampen the C nerve fibers, or the nerve fibers that cause pain. So if we're looking for something to avoid another pill that's topical, capsaicin is something for neuropathy that I think is worth trying. Otherwise, check with your doctor. But there's a lot out there. It's just important to figure out what works for the individual.
Great, thank you. We do have a hand up. I'm not sure here if you're able to chat or put it in the QA, let me know. But we'll go ahead and we'll keep going. The next question is, for a senior citizen, do you recommend an orthotic which has a soft surface or a hard surface? I find the orthotic with a hard surface provides more support, but the orthotic with the soft surface has been recommended for an older patient.
Yeah, that's a great question. I think, again, it depends on the patient. It depends on the foot type. It depends on what we are trying to accomplish with the orthotic. I don't know that it's age specific, although I will say that as we get older, we lose some of the fat pad on the bottoms of the ball of the foot and the heel. So we do want to look for things that have a little bit more cushioning. So in that respect, softer may be better. However, there is some benefit to orthotics that are more rigid. They can keep the foot in a more corrected position, especially if there's a real severe deformity, like a really, really flat foot or a really, really high arched foot. So there's benefit to rigid orthotics. There's also benefit to softer orthotics. There's semi-rigid orthotics, which are kind of a happy medium. It just depends on you, and it depends on your needs. But a good point about the age difference would be that more cushioning would be important as we get older, as we put more miles on our feet.
Perfect, thank you. Next question is, any suggestions for living with cold feet caused by Dr. Reynolds?
The question with cold feet caused by Reynolds?
Yes, caused by, I don't know. Okay, yeah, Reynolds.
Yeah, so Raynaud's, yeah, so that's a really good question. Raynaud's disease or chilblains or some of these other kind of microvascular type of disorders can be really, really affected by cold weather, and can be actually really, really difficult to treat. And usually we treat it in concert with rheumatology, or if there's some other underlying cause, vascular specialist, something like that. But any advice? Well, I mean, yeah, just wearing, wearing thick, comfortable socks, avoiding barefoot, avoiding altogether. I have a lot of patients who altogether avoid going out in the cold during the really, really cold months of the winter. The one thing I would avoid too is any kind of electric heater or kind of electric heating pad. I think that can potentially provide too much heat and lead to all kinds of other problems like burns and things like that. If we lose track of how long it's been on or something like that, it's easy to, or you doze off and now the heater's been on for 2 hours. I mean, that can lead to a lot of serious problems. So I would avoid doing that. But warm, thick, cushiony, comfortable socks. That would be my advice.
Wonderful, thank you. Next is, would you please comment on rigidus? I'm not sure if I'm pronouncing any of these right.
Hallux rigidus. Yeah. So, okay, we got a Hallux rigidus. Yeah. So we're using the real technical term. So that's good. So Hallux rigidus is it's a form. It's a really fancy way of saying there's arthritis in the big toe joint. So the hallux is the big toe. Rigidus, the derivation would be that it's stiff, or that there is a lack of motion at the joint. If you go back to let's see if I can go back. I'm going to go back to the X-ray. Not that one. Yeah, so, with Hallux rigidus or Hallux limitus, you can have a concomitant bunion. You can also have it without a bunion, but essentially it's arthritis where the cartilage lining the first metatarsal head and the base of the proximal phalanx becomes eroded over time. Could be from wear and tear, could be from trauma, could be from, excuse me, other causes. Over time, the cartilage wears away. It leads to bone-on-bone contact, which causes pain and causes decreased motion. The joint space shrinks down. The toe is not able to move as much. Bone spurs can develop on the tops or the sides of the joint. And because we push off of our big toe, because the big toe apparatus is so important for gait and for walking, if this joint is pathological or there's a lack of motion, then not only does it cause pain at that joint, but it can lead to other other locations of pain. So that's hallux rigidus in my nutshell. And there's different treatment options. Orthotics can be effective in severe cases, things like steroids, whether it's an oral form, an injection even, or surgery to essentially fuse the joint or put an implant in. And just like there are hip replacements and knee replacements, there are big toe joint replacements. They are not recommended to be used there's different age categories because like any other implant, it can break down, and so you may require replacement. And so it's really a discussion between implant or fusion, probably too much in detail for this conversation, but something that you should discuss with your doctor.
Excellent, thank you. Next we have, what can be done for arthritic toe with swollen joints?
Yeah, so similar to the hallux rigidus, a toe that has arthritis, we can have arthritis not just in the big joints like our knees or hips or ankles even, but in the toes and the metatarsals, and it can be from normal wear and tear, it can be from trauma. If a joint is arthritic and it's swollen, clearly that requires some sort of attention, and there should be, depending on the patient, there are different medications for that, non-steroidal anti-inflammatories like ibuprofen or Aleve or higher dose medications in that same family like Mobec or diclofenac or some other similar medications that are in that NSAID category. Injections with steroid to help relieve some of the pain and the swelling, and in really, really severe cases, surgery to address the arthritic joint.
Perfect, thank you. Next we have, what is corns? How should they be treated?
Corns, yeah. So a corn or a callus, or it's basically just a buildup of dry skin that forms over a part of your foot or your toe that's encountering a lot of pressure. So we think of callus as being on the bottoms of the feet, the ball of the foot or the inside of the big toe. A corn we think about on the tip of the toe, from rubbing against the ground or rubbing against the shoe. So you have to understand that corn is the secondary, secondary to a different pathology, whether it's a hammertoe or something else. So the corn is really the result of this pathology. So we can certainly treat the corn by, removing layers of dead skin, by adding padding to some of these prominent areas. But unless you're addressing the underlying root cause of why you're getting a corn, whether it's a hammertoe or a bunion or something else, then it will keep coming back more than likely. And so then you get into this predicament of, do you address the corn, with something bigger, like needing some sort of osteotomy, essentially a surgery to break a bone and and place it in a better position. So, simply put, you can shave down a corn and it can be done repeatedly, and that's fine, totally fine, good and well for a lot of people. For other people, if it keeps coming back and they want to do something more definitive about it, then surgery may be required.
Good to know. Great, thanks. Next we have, would you mention some topical medications for toenail fungus, both over the counter and prescription?
Yeah, so there's a lot of different ones, and the antifungal names, they kind of all end in the same azole. So there's miconazole, there's fluconazole, there's clotrimazole. They're on this kind of azole category of antifungal medication. We have one in our office that I happen to think is pretty good. It's called Formula 7. It is I believe a tolnaftate. It's another antifungal medication, but essentially it's like a nail polish that you polish on the nail, and it has the antifungal medication in it That's called Formula 7. That's a good one. There are some other ones. There's one called Jublia, which is a prescription, which has been marketed a lot, within the last probably decade or so, or maybe 5 to 8 years, which has some efficacy, but I don't know, that it's any more effective than some of these others. But those are a couple of examples.
Great, thank you. Okay, next question. What is the best way to strengthen weak ankles that I have a tendency to strain or sprain?
Yeah, it's a great question. So first and foremost, if there's a real instability of the instability of the ankle, then that should be addressed, with medical care, whether it's physical therapy, bracing, in some cases surgery, to make sure that that instability is not leading to more serious injuries. But as far as strengthening, there's a lot of different exercises that can be done. I recommend drawing the letters of the alphabet with your feet, while you're just sitting down. If you think about A through Z, kind of all the different directions, you're going to bring your foot and ankle, and that's going to increase motion, potentially strengthen those areas. Toe raises are a good exercise you can do to strengthen calf muscles, and as a product of that, strengthen the ankle joint. So there's a lot of exercises you can do, but I would make sure that there's no underlying pathology that needs to be treated.
That is good to know. I think we should all be doing those anyway. All right, next we have, can you suggest any shoe stores in Montgomery County or Northwest DC that would carry shoes that featured what you recommended, like the deep toe box with sturdy footbed?
Yeah, there's nobody that, I have any connection with. There's Comfort One, I believe, if they're still around. I think Shoe Fly is another that has a location. You can look for any running shoe store. Usually, if it's a running shoe store, you can still go there. If you're not a runner, they'll be able to, fit you and size you properly. But those are some examples, and some brands would be New Balance, Asics, Brooks, Hoka. Those are good brands of shoes to look for.
Great. Okay, next we have, I no longer get a pedicure because my immunity is suppressed. I don't need the nail polish, but I do need attention to dry skin. What does that service besides a pedicurist?
So the question is who to go to for like toenail care and foot care. Is that?
I think so.
Okay. Yeah. So I think that a podiatrist would be a perfect place to go, especially if someone is immunocompromised or is at risk for developing complications. If you meet certain criteria, then insurance or Medicare may actually cover those services to have your toenails cut on a regular basis and have your feet looked at by a doctor. In particular, if you have diabetes or a circulation issue or you're on blood thinners or something like that. Generally speaking, a lot of plans will cover that every 9 to 10 weeks. Or even if they don't, then just seeing a podiatrist regularly to cut nails and inspect the feet, that would be the place to go if you're worried about going to a pedicurist.
Okay, great to know. Thank you. Next, what do you do about swollen ankles and discolored skin around ankles when tests don't show anything wrong?
Yeah. So, well, first of all, it'd be nice to know, to have an explanation for the swelling, but I understand that swelling is one of those issues that sometimes doesn't have a good explanation. It may not be circulation related. It may not be fluid retention, but if it's safe, and this would be determined by circulation testing, then certainly some sort of compression stocking can help, even if it's not a prescription grade compression stocking. Something in the 10 to 20 millimeters of mercury can be helpful. There are higher grades too for more severe cases of swelling. Leg elevation whenever we're not walking can help a lot, but really just to try and figure out why there is swelling, especially if there's one-sided swelling, then that should be investigated too. But compression stockings, leg elevation, those are good, easy steps to do for leg swelling.
Excellent, great. Next we have, what do you think of Detox foot patch made by Block in China?
I don't know that specifically, but if there's an active ingredient or more information, I could possibly comment on it, but I don't know about that specifically.
Okay, that's fine. All right. Next we have, what other options do you recommend for hammer-toe besides surgery?
Yeah, so if we're not talking about surgery for hammertoes, then again, it really boils down to finding shoes that have a soft upper around the toes, like a mesh, or something soft, something with a wide toe box that won't rub against the shoes. They even make pads, like sleeves, essentially, that you can roll over the toe that have like a soft silicone liner, excuse me, that you can use, and you can find those things online or at a drugstore, but those are good non-surgical ways to address hammertoes.
Okay, good to know. What is a pronated foot, and is it genetic?
Yeah, so pronation, that's a good question. It refers to when the foot essentially is turning outward relative to the ankle joint. So I'm going to use my hand as an example. It's turning more outward. And so when that happens, it can cause a lot of stress and strain on other joints of our feet and lead to pain. It can be genetic, certainly. There can be some family history component to it. It can be just from normal wear and tear of activities that we've done in our lifetime, but it can be addressed with orthotics, inserts in our shoes, supportive shoes, or in really, really severe cases, medications, injections, surgery. But yeah, that's pronation. Pronation is very common and very commonly addressed with orthotics, I would say, as a first step.
Okay, great. Next we have, can you talk a little more about the liver problems that could arise from a Lansol tablet? Are the liver problems permanent, or will they go away when the tablet is discontinued?
Yeah, so the biggest warning is that the medication can elevate the liver enzymes. And so, this may be transient. It may go away once you stop, but actually, it may not. I don't think that is, I don't think there's a clear-cut answer to it, because if someone is predisposed to having liver disease or liver issues, then it's just not a medication that we would want to treat with. That's why we do, before the medication is started, we test the liver function first. Someone with normal liver function, generally speaking, is going to do just fine on the medication and can take it safely. It's those patients that have baseline elevated liver function, liver enzymes, that we want to avoid it in. So if someone comes in and we test and it's normal, generally safe. If someone takes it and develops liver problems, then I can't say if it's going to be temporary or permanent. The advice would be just to try and avoid going on the medication.
Okay, interesting. Thank you. Next, we only have a few questions left. Is there any treatment to prevent a hammer toe from developing more? My toe is beginning to buckle.
Yeah, it's hard to say. A hammer toe can be something that's hereditary. So in that case, there's very little you can do. Sometimes it can, though, have to do with the types of shoes that you wear or activities that you do. So, for example, if someone is wearing tight dress type of shoes for a long period of time, that can definitely contribute to the development of hammer toes. So the best advice would be to avoid wearing those kinds of shoes. There's going to be, you'll find all sorts of products as far as toe straighteners, splints, and other stuff that you can apply. And I'm not sure that in the long run they work to prevent it. I mean, I'm sure that's what they claim to do, and I'm not sure that anybody can prove that. But I think it's to avoid narrow, tight-fitting shoes. That would be the best thing. And if it's developing, there may not be a lot you can do, but try and avoid activities that cause pain. And if there is pain, to try and get it addressed.
Okay, great, thanks. Is it okay to use an electric blanket for cold feet caused by Raynaud's? Only thing I have found to warm my feet when they're cold.
Yeah, I mentioned the thing about the electric. I mean, I guess I would, I mean, it's fine as long as it's monitored carefully. And I totally get that's a good treatment option. I didn't want to say it's not. I guess my point is, if you're putting something like that on that's running continuously, and you lose track of the fact that it's on, or it's directly on your feet, that can lead to serious issues like burns. And you see it in the winter a lot. Actually, you see it with people trying to get their feet warm by putting their feet up on a space heater or on the radiator. And they, it gets so comfortable, right? You're warm and toasty and all that stuff. And then you fall asleep and it's like 2 hours later, you have like serious burns and blisters on your feet. So there's nothing wrong with that. And for Raynaud's and things like that, yes, it's very hard to find things that work. I agree. But you just need to set an alarm or have an automatic shut off or do something to make sure that it's not going to run continuously for a long period of time.
Got it. Good, thank you. And the last question so far is one more critical issue in finding shoes, accommodating orthotics. I have them from a FASFA doctor.
That's one of our doctors, FASMA. Yeah, what we go by.
Right. I'm not sure there's a question, but yeah, can you comment on accommodating orthotics?
Yeah, so I mean, orthotics need to go hand in hand with the types of shoes you're wearing. And so my advice would be that, if you're going to go get fitted with orthotics, bring the types of shoes you want to wear so that the doctor knows what they're prescribing or, what kind of shoe you're wanting to wear it in. If you get the orthotics and subsequently they're not fitting well, you can bring them back and see if they can make adjustments based on the types of shoes you're wearing. Lastly, if you're getting the orthotics first before the shoes, bring the orthotics with you to the shoe store and make sure that they fit in those shoes. So those would be my words of advice.
Perfect. Well, great. Thank you. I think that's all our questions for today, and we're just about done, a little over the top of the hour. So Dr. Isaac, thank you so much for sharing that wealth of information and that great presentation and answering all of our great questions. And everybody in the audience, thank you for joining us this afternoon and for your attention. Make sure you sign up for next month and the months going forward. And again, look out for that link I will send out with the evaluation. All right, well, I will wish everyone a great afternoon. And yeah, we hope to see you. Take care.
All right, thank you. All right.
Well, thank you. I'm going to end it. It's going to be a little abrupt, but
no worries.
All right.
All right. Thanks a lot. Take care. Bye.
You too. Bye-bye.